Managing epidemics and public health emergency. Epidemics of infectious diseases are occurring more often and spreading faster and further than ever in many different regions of the world. The background factors of this threat are biological, environmental, and lifestyle changes, among others. Fortunately, control programs are already long established and widely applied for some known epidemic diseases, such as cholera, HIV infection, influenza, meningitis, malaria, tuberculosis, and yellow fever. Even with the availability of medical countermeasures, some diseases remain a threat for many of the world's populations, either because of their rapidly evolving nature like influenza or because equitable access to effective public health measures is difficult. The first phase is the introduction or emergence in a community. The second phase is an outbreak with localized transmission, where sporadic infections with the pathogen occur. In the third phase, the outbreak amplifies into an epidemic or pandemic where the pathogen is able to transmit from human to human and causes a sustained outbreak in the community, threatening to spread beyond it. The fourth phase is reduced transmission when human-to-human transmission of the pathogen decreases, owing to acquired population immunity or effective interventions to control the disease. Epidemic management is the process of anticipating, preventing, preparing for, detecting, responding, and controlling epidemics in order that the health and economic impacts are minimized. It is an all-embracing term that describes all that needs to be done before, during, and after epidemics. Anticipating or predicting the occurrence of an outbreak helps in prevention. However, if the outbreak could not be totally prevented, it involves preparedness so that there is a readiness to respond. Early detection through a sensitive surveillance system is required to know when and where the outbreak occurs to limit its spread. Most importantly, a coordinated and rapid investigation is required to describe the outbreak and identify interventions, following which an effective response will be required to implement appropriate control measures. An epidemic management would not be complete without an evaluation to identify what went right and wrong before and during the outbreak. It is important to plan a systematic response based on the available data. The main areas to be dealt include definition of and agreement on response, management of response, resources for response, public information, post-outbreak activities, prediction of, and preparedness for further outbreaks. Some of the crucial steps in response interventions are establishing a dialogue between responders and communities, empowering communities, providing them with necessary medical and other supplies. Risk communication through experts is a life-saving action in public health emergencies. Treating patients through adequate clinical management can still protect and save lives. Protecting the health workforce through emergency planning, preparation, training and coordination. Governments focusing on significant increase of funding for healthcare services scaling up, along with increasing staff competency and capacity, understanding that the primary care is the first line of defense. Priority during outbreaks is to prevent the spread, provide appropriate treatment, protect those people who are most at risk and reduce mortality.